Good evening, everyone. My name is Sean. Today, I'm going to deliver a case study in an emergency setting. In this presentation, we are going through four parts of a case diagnosed with multiple organ failure and severe sepsis. The four parts are shown on the slide, which are what is happening, high priority clinical manifestation, why is it happening, pathophysiology, what else is involved, linking with other health issues, and how can we fix it, management plan. You might already know that emergency and critical care is based on efficiency. But did you know efficiency is not only requiring physical coordination, but also a comprehensive knowledge base? The more efficient a nurse is, a better quality of care, a happier patient, and a more professional image of nurses can be expected. Therefore, let us begin our journey to see the right way to evaluate and take care of an emergency patient. Today's case is a 75-year-old woman presenting from home with decreased GCS and breathlessness. The Australian Commission on Safety and Quality in Healthcare indicated that great monitoring can ensure the care meets patients' need. The organization also outlines several key parts to monitor, including respiratory rate, saturation, heart rate, blood pressure, temperature, level of consciousness, and behavior. These elements generate the format of primary survey as the A-G assessment. When conducting an A-G assessment, a SAGO chart is used. The SAGO chart highlights the abnormal sector while patient saturation is 75 on room air, which is showing on the next slide, which has reached the red zone, and patient is rousable to voice at 39.8 degrees Celsius, which the disability and exposure has reached the yellow zone. Therefore, reporting and escalating these signs of deterioration is mandated. Some conditions of the patient also meet the criteria to trigger a red zone response, including high PaCO2. In the case study, the patient reached 120 mmHg, low pH, 7.12 for the patient, and low BE, base axis, which the patient reached minus 5.2. Apart from the signs, subjective symptoms should also be considered as well. The next slide shows the complaints from the patient's family, since the patient is too drowsy to provide any information. Patient's family says that patient has been drowsy for the last 3 days. Based on the complaints, the major concerns is breathing. Dyspnea is one of the most common symptoms presenting to the ED. Such symptoms could associate with life-threatening respiratory conditions, such as pneumonia. In general, based on all highlighted evidence, including low saturation, decreased GCS, fever, elevated PaCO2, decreased pH and BE, dyspnea, and cough, we can identify that breathing issue on the highest priority when treating this patient. After an initial investigation, the patient is diagnosed with multiple organ failure, which is also known as multiple organ dysfunction syndrome, MODS, and sepsis. Sepsis is defined as abnormal response to infection that inducing life-threatening organ dysfunction, whereas MODS is defined as simultaneous dysfunction of multiple organs. Moreover, sepsis is most related to the development of modes. In the diagram, lack of oxygen and nutrition supply to the cells resulted in the development of multiple organ dysfunction syndrome. First, ATP will decrease since there are not enough materials to supply the production. As it moves on to the electrolyte balancing system, sodium-potassium pump is the first one being struck. Sodium-potassium pump requires ATP to initiate the process in order to keep sodium-potassium balance between extracellular and intracellular cavity. However, when a pump stops, intracellular sodium will accumulate and causing cells to swell. If the process cannot be ceased in time, swelling cells will rupture and die. After the death of the cell, the accumulated calcium will return back to the circulation and further disrupt the function of mitochondria, which is the unit of ATP production. As a result, another round of cell dysfunction will initiate. As reviewing the clinical manifestation of the patient, certain links with multiple organ dysfunction are discovered. First, the patient acquired an infection and resulted in pneumonia. The infection leads to desaturation, which patient presents SpO2 75% on room air, and tachypnea, which patient presents breathing rate at 28 times per minute. Then, the inflammation caused patient's temperature rise to 39.8 degrees Celsius. The white cell count and CRP also elevated as they reached 25.8 times 10 to the power of 9 per liter and 176 milligram per liter, respectively. Sepsis shows up as the condition moves on, which is going to generate inappropriate immune response in the body. Based on all materials above, patient's body is currently lack of oxygen and nutrition supply due to pneumonia-induced lung failure. Moreover, the severe inflammation disrupts normal metabolism and the immune system. As a result, imbalance of electrolyte and death of the cells will occur, which ultimately forms multiple organ dysfunction system. Indicators have been found on the patient's blood report. Bilirubin is related to the function of the liver, and the normal range is between 0.3 to 1 milligram per DL. Patient's latest bilirubin count is 4 milligram, indicating that patient's liver function has been affected. Creatinine is related to the function of kidney and could be used as a tool to determine kidney's health. New South Wales Health have listed the normal creatinine number of adult female is between 45 to 90. The patient's latent creatinine number is 144, indicating that damage has occurred in the kidneys. Upon the arrival on the patient is unable to provide information. Thus, family has provided past medical history on behalf of the patient. According to the family, patient has hypertension, emphysema without receiving any treatment, ischemic heart disease with left ventricular hypertrophy, and smoking habit. These information can be separated into two parts, which are heart-related and lung-related. Left ventricle is the gateway to the body circulation. However, patient's left ventricle is oversized, which leads to the accumulation of the blood in the ventricle. Patient's vital signs are the explanation. The heart is beating rapidly at the rate of 118 beats per minute to compensate the low blood pressure. However, inadequate blood flow is entering the blood system since the left ventricle is enlarged. Thus, the blood pressure remains low at 90/50. Smoking is the leading cause of creating chronic lung disease and predispose people to acute lung disease or infection, such as pneumonia. Emphysema is common among smoking population and could potentially cause a severe inflammation in the respiratory system. Patient is having both emphysema and smoking history. Therefore, patient's lung is more vulnerable when experiencing infection. As patient desaturated to 75% on room air, and respiratory rate at 28 times per minute. After establishing a general insight to the patient's condition, a management plan should be created in order to relieve the patient as soon as possible. The current health issue of patient can be separated into three parts, which are breathing, fever, and inflammation. Breathing is top priority since it ensures the supply of oxygen to support body function. Patient is currently using BiPAP with FiO2 50% and the SpO2 raised to 95%, which is good. However, for patients using ventilating machines, it is important to prevent VAP, ventilator-associated pneumonia. Nurses should ensure the sanitation of the ventilating environment by delivering ventilator care, such as regular oropharyngeal suction, and mouth care, such as brushing teeth. The second step should focus on patient's pneumonia, since it is the reason of the patient's admission. For the ongoing pneumonia, it is vital to tackle the infection to shorten the period of severe inflammation on the patient. The usage of antibiotics should be discussed with doctor after patient is diagnosed with pneumonia in order to resolve the clinical symptoms as soon as possible. Timely administration of antibiotics could potentially prevent further deterioration of pneumonia. The third step is to address patient's fever. Being febrile is an enormous suffer for a patient. Therefore, discuss with the patient about temperature management is important. If the patient requests medication, nurses should discuss with doctors to evaluate the usage of analgesics such as paracetamol or ibuprofen. In conclusion, nursing care is multitasking and requires substantial knowledge to accomplish. This presentation has demonstrated the system from identifying to reacting. Such system will play an exceptional role in facilitating the efficiency of a nurse. Here's the reference list, and thank you for listening.